I have certainly my impression of what I see in people who come in and their pain is gone. It's not necessarily always just this, well, hey, it's awesome now. Life is great, Sometimes they really struggle with the fact that they're better because they've been so bad for so long. So, having psychologists and behavioral therapists there to kind of help shepherd them through that process, I think, is also important.
Yeah, for sure. And just to answer your question, when you're handicapped with headaches, it almost becomes an identity,
Mm-hmm.
and you can really settle into that identity and just relax into the idea that, you know what, I can't handle a career, so I don't really need to worry about that.
Mm-hmm.
I'm handicapped basically,
Mm-hmm.
and when the headaches get significantly reduced to the point where you're a normal person again, you're not perfect, but
Mm-hmm.
you might need to take a few days off a month, but it's not every other day.
Yeah.
Then that creates a new problem, which is that you got to figure out what you're going to do with your life because you're not handicapped anymore.
Yeah.
And that's a good problem to have, but it's almost like as an adult, you're graduating from school fresh into the world and you got to start from scratch and put together a life. In my case, I was able to sort of build off of my experience with headaches to, apply to dental school and then ultimately get into migraine hacks, then jaw hacks. So I've found a way to make it work, but it is a bigger problem than you would think. And just to speak to one of the weird psychological effects it's had on me, it did take me years to sort of get over some of the trauma. And evidence that the trauma is not all gone is that I still stockpile triptans. So I have a event set in my calendar monthly.
Mm-hmm.
Every month I fill my prescription, and I have a box full of triptan pills. A lot of it's probably expired, but I still keep doing it because somewhere in the back of my mind I'm thinking, if the world falls apart and we all, have to live off the grid and this and that, at least I'll have my triptans just in case because I'm so afraid
Yeah.
of that terrible 8, 9, 10 headache pain.
Yeah. No, you have said it so well, and I've said for years that one of the I think there's three types of people that I see post a great result from surgery. There's that percentage of patients that's like the gazelle that got chased by the cheetah on the savannah but escaped, and they kind of take a breath, recover from surgery, and then it's like, okay, great, I'm eating grass again, and life is good, and I'll just kind of go back to my world. And that's wonderful, and that's great to see. There are those people who I think are understandably very angry at especially the medical community when they feel like they were running around in the dark for so long, and here you meet a surgeon. It's not necessarily just me, obviously, but other surgeons that do this work, and they are quote unquote fixed or a lot better, and they were just so angry as to why it took so many people so long to figure this out. And that's very understandable too. And I think that that's something to work out. And then there are those people that, as you perfectly pointed out, their whole lives have been centered around this pain. And when you take that away, there's almost a void there. And like I said, it's a good problem to have, but it takes it's not unlike I would imagine if you were suffering from PTSD as a result of being in a war or being a prisoner of war, and then you're reintegrated into the world, or you're supposed to be reintegrated into the world. It's like, yeah, here you are, you're back, you're safe and sound, no one's going to shoot you, you're back home, stateside, and so just go and get a job and do your thing, and it's really not that easy. So what you're saying again makes total sense. And I don't think I think it's one of those aspects of the care that we provide that I think is often overlooked, and I think that it's so important because I think that being able to take the trauma of pain for so long and work through it, I think predominantly with therapy, I would guess. I mean, I'm the furthest thing from a psychologist that you could meet, but I remember talking to a therapist one time. He said, look, the way to deal with trauma of any kind is not to medicate it away. And yes, that is necessary in some patients. I'm certainly not belittling that. There are people who are understandably very depressed. People are talking about very interestingly all sorts of psychedelics and MDMA for people suffering from real PTSD. So, there is a medical underpinning to what happens to patients who suffer those things. But I think there's also a lot to be said for kind of talking it through, processing it, sitting down with someone who can kind of guide you in a professional way. Say, look, Ronnie, what are you thinking about when you go fill your prescription? I mean, you have 600 pills at home, like, and I'm not saying that that's wrong. It's totally understandable, but and that's probably not something that's breaking your bank, hopefully, or causing you to miss 6 days of work a month to go and fill out those prescriptions. But for some people, the things that they deal with still, despite the fact that they will tell you, I don't have any more pain, or my pain is just, it's almost negligible, they still deal with the sequelae of that. And I think that that's very important, and is going to be ultimately part of the treatment that will take them to the level that most of us hope we function at normally.